You're right. I think a lot of the studies that I presented here kind of highlight things that we've known about sort of disparities in care access. But I think what we're starting to figure out is that the disparities in different communities and different groups likely happen for different reasons. And so I think that's where we're really trying to understand and disentangle sort of what those barriers to access are. And really that's kind of what a lot of our work was focusing on, because I think we have to kind of identify those differences in access issues so we can start to have interventions that we can sort of target those unique needs of the communities. So I think that is probably one of the main things. So there's not a panacea of what like the access issues are. And then I think we've also found too, as care delivery methods have changed, right? You know, with the advent of now more ubiquitous use of telehealth, really understanding how those changes in care delivery methods can impact disparities in a positive way potentially, but also can potentially create new disparities and maybe even widen some disparities. And that's obviously a very evolving issue. So I think that those are really kind of the two bigger new things, is sort of that the disparities likely are occurring for different reasons, right? And then secondly, our healthcare models change, and then that is going to shift sort of what those disparities look like. Definitely the study that we presented here was specifically looking at, you know, large comprehensive MS centers and sort of where those are located. But as you highlighted, you know, it's not just a matter of the lack of those MS centers and access to those. Really, there's a lack of neurologists in general. And so some other work that we'll actually be presenting at another conference really looks at sort of mapping and understanding where neurologists are in the country. And although obviously the access issue is even wider when you narrow it down to the like 188 MS centers that we looked at, those access issues really remain even when you expand it out to neurologists in general, is that they obviously are largely centralized at bigger academic centers, or even if they're not academic centers, more urban centers, or, you know, near proximity to urban areas. And so I think that there's a lot of concerns about just neurologic care in general, and that impacts our MS patients. And so I think that, you know, one is the hope is that I already mentioned is, you know, telehealth can help kind of bridge that divide a little bit in sort of that geographical location issue, which I think a lot of what we saw in our studies is that, you know, for rural communities or micropolitan communities, that telehealth utilization might help with that access issues, which is encouraging, because there's actually quite a few studies outside of neurology where rural communities actually may underutilize or have less utilization of telehealth, potentially for, you know, broadband issues. So I think that's encouraging in the MS field, that we see that telehealth utilization in, you know, more of our rural communities is good. So I think that is a potential way to bring, you know, improved access. But then I think we have a different problem when it comes to our urban communities. You know, when we saw that the utilization and access issue, obviously from a proximity standpoint, isn't the problem. You know, we may have a patient in an urban area that lives, you know, a half mile from an MS center. And so in theory, they have great geographic access, but that geographic access is only part of the picture, right? And so I think that that's where it's one dimension, as I alluded to, that we can identify and potentially have some sort of interventions to help some communities, but then, you know, geography is not the answer for everybody. And so then we have to start to understanding really, well, why is that barrier when you live right down the street from even an MS center, right? So what are your unique barriers? And I think that's where we don't necessarily have a great grasp of what that intervention looks like. And so specifically when we were looking at sort of telehealth utilization and the geographic access, our urban Black communities, right, might have, in some ways it looks like, better access to care if you really just look at it from that standpoint. But obviously there's a huge disparity in care access in communities such as that. And so it's not a proximity issue. And so that's where we absolutely need to engage communities to understand, well, what are the barriers there?